For those of you who don't know, I'm Rich Shaw with CardioKinetics, one of the people who provide your biometric health assessment since 2016, so for the last 4 years. Today what I want to share with you, very briefly, is what has happened. What have our findings been since we started this program in 2016 to this past year? Coming in November to start testing you again. There, we get the light in there. Okay, so we're going to come in November, but I want to show you really what you've done. Quite honestly, it's been super positive, incredible results. I know you might be surprised by that, but really, it's been really good results. There are still areas we want you to work on, and I'll address those too, but I want to try to show you what we've found. Everything we look at is confidential, so all I'm showing you are percentages. No, there's no personal identifiers, obviously. And if there's any questions, please don't hesitate to ask. Just as a reminder, anybody that has not had the screening done, it takes 20 to 30 minutes. Very simple, one-on-one, height, weight, body mass index, resting blood pressure, your pulse, abdominal circumference. We do a finger stick, getting immediate results on total cholesterol, HDL, LDL, heart rate ratio, and triglycerides and glucose. And cotinine is a byproduct of nicotine. It tells us your tobacco use. We take all that, put in a health risk profile, and then show you, not only where your status is currently, but in the future, look, you're at a above average risk for developing diabetes, or you're below average risk, and what are the reasons for that? That's the kind of things that we do every year with you guys. You probably don't remember, but I talked about metabolic syndrome quite a bit over the years. And metabolic syndrome is just a term that says you have 3 or more major health risks. In the United States, about 34% of the adult population has that. That puts you at a higher risk for all diseases. We don't want you to have that, okay? We want to make sure that you have less than those risks. You guys, the last time we tested you, 15% of you had metabolic syndrome. When we started with you, you had 32% of you had metabolic syndrome. A huge improvement, right? Phenomenal. Now those 15%, we still want to get them out of that category, obviously. But really, that's a major improvement, and compared to a lot of other organizations, that's really very, very low. So again, congratulations to everyone at Price Auto. That's an excellent result. The most significant improvement since 2016, only 2% of you had high blood pressure when we screened you this past year. You started at 13% and you're 22% better than the national average. That's phenomenal, right? Really, really phenomenal. I already told you about metabolic syndrome, but I wanted to point out that's also 20% better than the national average. And again, when I say national average, I'm comparing you to not the entire nation, I'm comparing it to the same demographic we tested, the same age, gender, and everything. So we're really comparing apples to apples. When we evaluate you, we're also telling you, as I said, you may be at risk for developing diabetes or above average risk. When we first started with you, 49%, almost half of you, were above average risk for developing diabetes. Now that's down to 33%. Huge improvement, but we still have a third of you that are above average risk. We want to see that improve even more, but that's really an incredible improvement. All 6 of the blood tests that we look at are better than the national average. Your primary care physician, 88% of you said you had a PCP this past year. Phenomenal. Just as shortly as back in 2018, only 21% of you were saying you even had a PCP. So major improvement in that area also. So significant improvements. Sustaining those is going to be a challenge. I know it, especially during these times, but that's what we're hoping for. Sustaining it. It's just like if you all of a sudden you start exercising, you get yourself to a certain level, keeping it there. Okay? Same thing. That's what we're looking for. And anything we can do to help you with that, we want to do that. Remember, we're not just evaluating you once a year. You can come to us, call us, email us anytime during the year to discuss your results, to discuss how to improve a result, how to get to the physician network. Remember, we're a licensed medical provider providing cardiac rehabilitation and cardiac diagnostic services too, and been doing so since 1979. So I have a huge network that we can help you with that also. Now, for areas we'd like to see you work on, hope we improve. Now this is kind of a double-edged sword. Obesity is at 39% for you guys. And it stayed the same though for the last 3 years. If I was really being honest, that's good compared to other organizations. It's usually going up, right? It continues to rise, so you're kind of holding your own. We'd like to see that improve, but at the same time, you are kind of holding your own there. In the next 5 years, it's projected, looking at your test results, that 10 of you will become diabetic. There's already about 10 that have diabetes, but 10 more if you didn't make any changes. The majority of that does not have to happen. If you made improvements in your health, you would not become diabetic, and that's what we're trying to work towards so that doesn't happen. So in the next 5 years, that's what's projected, and that would double the number of people that have diabetes at Price Auto. So we want to really try to look at that very carefully, try to help you with that. And then preventive care has not been the best, right? You're doing a great job coming to us and working with us, but only 41% of you had an annual physical that last year. 41% of the people that are 50 and older have had a colonoscopy ever, and only 54% of the women over the age 40 have ever had a mammogram, ever had one. So we encourage you to do that. I know this year is not the best year to ask you to do that. I get it, all right? But moving forward, keep that in your mind. Now, here's where the rubber really meets the road. We developed an incentive program with you guys, the second year we were evaluating, because you evaluated you the first year and said, okay, here's what you look like. Let's see what we can do to encourage you to change and meet this criteria. And if you're meeting this criteria, you're going to pay less in your benefits plan. If you're not meeting it, you're going to pay more in your benefits plan. And as a reminder, all we're asking you is to not have an abnormal result. We're not asking you to be ideal. We'd hope for that. That would be great. But we're really saying, look, don't use tobacco. Have a body mass index of less than 30, or your waist is under 41 or 36 for a female, or you lose 2 BMI points in that year. Okay, so we're giving you many opportunities to try to meet that criteria. Just don't have high blood pressure, 140/90, has to be less than that. And just don't have an abnormal HDL level, less than 40, and LDL, the bad cholesterol, greater than 130, or triglycerides higher than 150. That's considered an abnormal result. It's not close to where we want you, quite frankly, right? But that just means we don't want you to be there. And glucose less than 110. I really want you under 100. So we give you wiggle room in there to try to meet that criteria. If you look at that, then you are assessed points for each one of those. So if you don't do the assessment, you get that surcharge of over $2,000. Here, look, tobacco-free is worth $480 per year, $480 for meeting the body composition, $240 for blood pressure, lipids at $240, glucose $480 for a total of $1,920. You would pay less into that benefits plan by meeting those criteria. Now, wrap your head around that, because this is really cool when you look at this. From 2016 to 2019, 51% of you were meeting the criteria. Now 81% of you met the criteria this past year. Huge improvement, 30% more. 58% were meeting the glucose criteria in 2016. Now 94% are meeting that criteria. Phenomenal result. Blood pressure went from 87 to 98%. I told you before, only 2% of you are hypertensive. Meeting the lipids, lipids is just your cholesterol and triglycerides, 42% to 54%. Tobacco use is staying right about the same at 21, 22%. Right? So all those have improved significantly. That one has not. But that's a major improvement. I told you before, metabolic syndrome is what I'm trying to get you guys out of, right? Not having 3 or more major health risks. With that in mind, here's kind of where I get really excited. If you look at this, 18% of you were meeting all 5 of those criteria in 2016. That's up to 32% of you meeting all 5. That's a significant jump. That's a major jump. 49% of you were meeting 4 or more criteria in 2016. That's up to 73.5%. Now 3 or more, meaning you don't have 3 or more risk. That's what we're looking for. We're trying to get you out of that. 79% were meeting 3 or more health criteria. Now that this past year was up to 92.5%. Great result. So it's working. You guys have done a phenomenal job. Have you changed every lifestyle habit? Have you changed every health risk? No. But many of you have addressed some of those categories. And that's what's getting many of you out of that metabolic syndrome. Maybe you can't get rid of all of them yet, but you're getting rid of some of those. Now this year, we've been challenged. All right? Obviously with the pandemic, we're now saying, okay, lifestyle habits are going to be somewhat different. Doesn't mean you can't go out and be active. Doesn't mean you can't improve your diet. You can still do the same, but you're being challenged differently because your lifestyle is somewhat different. We're here to help you with that. And when we come back in November, we're going to evaluate you, and whatever your result is, remember, we're not judging that result. We're just telling you, look, here's where you are in 2020. If you want to improve that result, here's how we think you can improve that result. By either changing a lifestyle habit, getting the proper medical intervention, or a combination of the two. And please do not hesitate to reach out to us. Anyone who evaluates you will give you their card, so to give you their email information, cell phone number, you can call our office, anything we want to try to help you. Any questions with any information I've shared with you so far? All right. You've done a phenomenal job since 2016. We're going to see what 2020 holds. I hope it's going to be a good result. We will see. And I'm going to come back and report that back to you once we get all that data. Thank you very much, and good luck in November. Thank you.